Do you sometimes feel that you don't empty your bladder well, that you're having to head straight back to the bathroom to pee again? Did you ever think that you'd be watching a video to learn how to pee? Well, sometimes as we get older, after having babies, after surgery, and well, sometimes just with time, things change and we actually have to think about these things. My name is Eileen Yee, and I'm a urogynecologist, and here are 5 tips to help you empty your bladder better.
The first tip, as silly as it may sound, is just simply relax. Don't be in a hurry, don't hover, sit squarely on the toilet with your legs slightly apart, sitting upright and your feet firmly on the ground. Then take a deep belly breath, expand that lower tummy. After that, exhale. Imagine your pelvic floor, your bottom, like an elevator slowly dropping down. Relax, just pee, see what you can do. After that, wait a few seconds and try this exercise again.
Tip number 2, lean slightly forward. With your back still upright, lean slightly forward. Place your forearm on your thighs. Use your arms to brace yourself. This way, you're not tightening your abdominal or your back muscles to keep yourself upright. This way, you can simply focus on relaxing. If you have a bad back or feel a little wobbly leaning forward, then you might want to get a squatty potty. And what a squatty potty is essentially a stool that fits around the base of your toilet that's about 6 to 8 inches high. If you don't have a squatty potty, any lift of a similar height will do. And when you rest your feet on that lift, it creates an angle, much like how leaning forward does. It helps open up the pelvic floor and allows you to empty better. Tip number 3, do the hula. Because we come from Hawaii, we have our patients do the hula on the toilet. We have them shift slightly to the left, slightly to the right, lean slightly forward, lean slightly back, and see if simply shifting your positions helps you empty better. Number 4, credé on your bidet. With the credé maneuver, you're placing a gentle amount of suprapubic pressure right above the pubic bone to give your bladder a little bit of a push. To limit the amount of pressure that you're exerting on your bladder, I usually have patients make a fist, place it at the base of your belly, and lean slightly forward. And that way, it limits the amount of pressure that you're placing on the bladder. Because above all, we don't want you to be bearing down or pushing too hard to empty your bladder, as that can result in a host of other issues. If you still feel like, nope, there's still something left inside, then try double voiding. Pee, get up, walk around for a minute or 2, and then sit back down and see if more comes out. You don't have to do all of these maneuvers each and every time that you void, but say several times a day when emptying your bladder better counts the most. If you wake up often at night, do these exercises before going to bed, or before leaving the house, or after you've had a lot to eat or drink. Try these exercises out and see what works for you. If you're at the end of this video and you still feel that you can't empty the bladder well, the bonus tip is seek the care of a healthcare provider. Because 1, your doctor can check to see how much urine is left over in your bladder. Because the truth of the matter is, even the best of bladders don't empty 100% completely. If what's left over in your bladder after you pee is 100 cc's, or this urine cup filled to the very brim, then that's totally normal. Reason number 2 is that there may be treatable and reversible reasons for you not to empty your bladder well. It may be related to constipation, an infection, medications that you're taking. Sometimes it might be related to problems going on in the pelvic area that's causing a blockage. For women, it might be issues of prolapse. For men, it might be issues of a prostate. And these problems can be entirely treatable and reversible. So try these suggestions, but if you're still struggling, seek the care of a healthcare provider and start the conversation. If you found this video helpful, hit that subscribe button for more content and let me know what lessons of a better bladder that you'd like to see.